Hello, I'm Dr. Greg Winteregg. I'm a dentist and a partner at MGE. And for this week's Tip of the Week, I'm going to touch on a subject that might cause a little bit of debate for a staff meeting. I'm talking about the use of cell phones in the office. Now, you can have whatever policy you want to have as to whether patients need to turn their cell phones off or on silent or vibrate. Whatever you want to do there is fine. But if you've watched my Scheduling for Productivity DVD, it's all about taking care of the patient. And if staff have access, and doctor, have access to the cell phones during the work day, when you have your attention on your cell phone, you don't have your attention on the patient. And you can say, well, it's just a quick text. It's just a second. Okay, that's true, but then what train of thought now are you going to have after that text message? Oftentimes, it's not over, and then there's a second one, and then there's a reply, and that's all taking away from putting your attention on the patient. You know that my policy is if a patient is in the chair, if at all possible, we want a staff member there talking to them. But if a staff member is somewhere else in the office handling a text message, then you don't have your attention on the patient. So my policy would be no cell phones by staff or doctor during productive hours. Over lunch, that can always be handled, and you can say, well, in case of an emergency, well, there's still landlines. So anybody can call the office in case of an emergency with a child or a relative or loved one and still have access to you. So that's my tip of the week, and I will end off with this. If the policy that you have right now is working, by no means change it, but I think cell phones should be limited during patient hours. Have a great day.